in store for something super fantastic today. You have like 4 head and neck surgeons today that are going to talk about anatomy. You're going to hear all about how to use an ultrasound. There's going to be some techniques. There's going to be 2 live injections. We're going to give it to you all. We're going to squeeze.
The rhino filler, the correction of the nose with a filler artery that come from the facial artery and make anastomosis in the middle part on the bone. So when you are deep and you are touching
into the tip, it's probably compression. This is where, I mean, you're talking to 3 surgeons here who probably have a higher chance of wanting to correct something post-surgical than.
Because we need to understand that body is full of vessels. So
just relative to the vascular occlusion thing, just to ask my colleagues up here, if you were to get a VO, so I think we have to stratify things a little bit, and we were talking sort of back here moments ago. In the upper part of the nose, that's where you're.
So I'm going to show you guys one technique that I think is interesting with the tip, where it's and this is the nice thing about going to these conferences, because you see different approaches to the things that you're interested in doing. So, for example, in the Italian physician that you saw is doing this with cannula. We're going to be doing this with a BD syringes.
Caliber, and it's very difficult to inject a lot of product quickly. Okay, so that's one of the biggest risks in getting a VO is flooding the area too quickly, especially with the larger caliber needle. Flat avatar nose. So I'd much rather them have a little bit of a bump, but still have a nasofrontal angle than blunt that angle entirely trying to chase that. So we're just going to get started. So usually I compress laterally as I sort of start to do the injection.